Hello, my name is Dr. Brian Troutman of Mount Pleasant Chiropractic and Rehab, owner and chiropractor of that office. I'd like to welcome you to our series of super helpful tips on better health. Tip number 2 is on stress. Stress. Just breathe through it. That's the title. So do you have a hard time relaxing? Do you have a difficult time with stress? Here's a technique to help you with better stress through better breathing. One way to decrease your stress is to work on controlled breathing. This technique involves breathing for benefits of ridding your body of excess carbon dioxide. It's called 12-6 breathing or 20-10 breathing like I was taught. Here's how to do it. Inhale slowly for 6 seconds. Exhale for 12 seconds. Repeat for about 2 minutes or about 6 to 7 times. Once you get the hang of it, you can increase the time to about 16 to 8 breathing, or even with a longer overall duration for more minutes of the exercise. You can do it for about 5 minutes or so. Just keep the same ratio of inhaling and exhaling, 2 to 1. Here's how it works. Your body's cells rely on 2 things for life. Glucose, which is the food you eat, and oxygen, which is the air that you breathe. The technique helps with ridding your body of excess carbon dioxide, making more room for oxygen, which equals better function. The less carbon dioxide in your body will make your body's environment more basic and less acidic. In an acidic environment, your body will create more inflammation and dysfunction. On the other side, or conversely, less carbon dioxide in your body, a more basic body, creates less irritation on your nervous system, less irritation on your body, therefore better function. Less inflammation equals less disease. It also stimulates the parasympathetic nervous system, which is for rest and relaxation, digestion, and breathing. Stimulating the parasympathetic nervous system will relax the sympathetic nervous system, or the fight or flight response. This can calm you in a few minutes, take you out of pain quickly, and also help you sleep better. So if you feel dizzy, nausea, lightheaded, feel like you're going to pass out or faint, I would stop the exercise immediately. Seek assistance or even medical assistance if needed. You should feel invigorated if it's during the day or during a stressful day. Have more energy. You should feel more relaxed and calm. Deeper, easier breathing equals a better rest, better sleep. If you're still feeling stressed, then you may need to have your nervous system checked for interference. You may have a misaligned vertebrae in your spine. I would check the upper cervical spine or the lumbopelvic area. Stress or injury to those areas could cause a problem to the parasympathetic nervous system, lead to problems of eating, sleeping, and breathing. So that brings to mind a success story with one of our littlest patients. One of the first ones I had, first pediatric patient, one of the first ones. She was 6 months old and referred by 2 of her grandparents that were patients of mine. Brought her in about this big, basically like a little screaming football. I didn't know really what to do. I actually did, but getting experience with it. I knew to look for her upper cervical spine because her mother was telling me of a pretty traumatic injury during birth. I believe she was extracted from the uterus with forceps, salad tongs. Okay, a lot of injury there. When I checked her out, she had a really big head tilt to the one side. Palpated the first cervical vertebra. It felt like you could hold a coat hanger off it. This is that upper cervical area. It was way out of position. As you can see, that hole closed up. That would put pressure on the brainstem. That would give her a lot of pressure on that sympathetic nervous system, cause her to be more in fight or flight all the time. When I went up to her and touched her, she reacted as if somebody scared her all the time. So she had a hard time holding her bottle, being held, hard time eating, sleeping, and going to the bathroom. That's pretty much what kids do anyway. That's the only thing that they do. So with about 2 to 3 adjustments, remember that after that third one, putting that bone right back correctly where it needed to go. About amount of pressure I could put my eyeball without it having any kind of pain. She started to breathe a whole lot easier. She just looked very relaxed. There was a sign of relief on her eyes. Her mom took her home. She slept for about a day and a half, called pretty concerned, which I was pretty concerned at the time too. But I knew that parasympathetic nervous system was starting to really click in. She brought in a testimonial, one of my favorite ones, and it said, "Thank you, Dr. Brian. I can crawl, I can sit, I can stand. I can hold my bottle, no more tears, all day long. So thank you. I appreciate that. That's one of my favorite testimonials. I love doing what I do. And if you happen to have more stress and some of these things are things that you feel that can be helped out with, feel free to try that breathing exercise or give me a call at the office, 262-633-6325, or you can check our website at www.racinechiropractic.com. Thank you. Have a good one.